Hi, I'm Alex Howard. I'm here with Tanya Page, Director of Nutrition at the Optimum Health Clinic. So hi Tanya.
Hello.
And in this video, next of our videos, in our series of videos around reasons why people have reactions to supplements. And this is actually the first of two videos in a kind of subcategory within this, looking at detoxification. And in this video, we're going to talk about liver congestion. And in the second part of this, we'll talk about lymph congestion. So maybe Tanya, as a starting point, when we talk about detoxification, what do we actually mean by that?
Yeah, detoxification is just the body's way of getting rid of toxic substances, whether they're external things that come into our bodies or things that we produce ourselves, like hormones, for instance.
Okay.
Now, in relation to reactions to supplements, it's quite common that when someone first starts taking a supplement, if it's something that fires up the detoxification pathways, for instance, something that supports the liver or something that gets the digestive system or the gut going a little bit more than normal, then the body thinks, okay, I can detoxify. So you tend to get the sort of classic detox symptoms like headaches, nausea, just feeling very under the weather, under par compared to normal. Mm-hmm. Now that's quite common to have when you first start a supplement, not always, many people are absolutely fine on supplements, but it can be when you first start a supplement you can get a detox reaction to it. Now under many circumstances that's more than tolerable, and we can advise people, and which is what we do in our paperwork anyway, to start with a low dose, restart with a low dose and work up so that you build up your tolerance to that product slowly. But in terms of what we're talking about today, it's more that the detox reaction is just totally overwhelming.
Okay. Even
with small amounts of supplements, even several days apart, even with tiny, almost molecular amounts of the product, you still get a reaction that you really can't cope with.
Yeah, because in one of the initial videos, Julia talks about one patient who they literally started on 1 grain of it, rather than a whole piece of 1 grain, and over a year were able to build up, and it was really, really effective for them. But what we're talking about here is even when that isn't working as a possibility.
That's right. So obviously if a patient's experiencing that, they need to talk to their practitioner to get the sort of big picture as to what is true for them.
Yeah.
Because sometimes literally it is a very slow process of building up tolerance. For others, we'll kind of know instinctively from what the patient's saying, actually this is not going anywhere, this feels like there's a block somewhere, and they just can't get over that hurdle of introducing it. They just continue to feel horrible, and that's not good for morale, it's not what we want.
Yeah.
So at that stage we would start to consider, is it literally a blockage in the system somewhere, either liver or lymph?
Yeah. Now in this video we're talking about liver, so in part 2 we'll talk about lymph. So when we talk about liver congestion, what do we actually mean by that?
Well, there are a number of pathways in the liver, split into 2 parts. There's phase 1 and phase 2, and there's a number of different pathways in phase 2. So there's quite a lot that can go wrong. Phase 1 can go wrong, or one of the parts or several of the parts of phase 2 can go wrong, in which case toxins that are being detoxified by the system just don't get through that process well enough. If that happens, they start recycling and then you feel dreadful. Mm-hmm. So it's a matter of us working out from the symptoms what pathway may be involved, and therefore doing something about it.
Okay, and what would be some of the symptoms someone might be experiencing?
Okay, it's one of the classics is B vitamins actually that are a problem for the liver. Commonly nausea, so this is where we'd have to distinguish between whether it's stomach acid or whether it's liver. With problems with the liver, you often get headaches, you often might even get migraines. You can get dark circles under the eyes, that's quite classic. Those sort of symptoms. And given that is the case, we would look much more closely with liver and support accordingly.
Okay, and you mentioned kind of liver support. What would be some of the things that we might, obviously this is a whole big area of itself, but kind of briefly, what would be some of the things we might do to support the liver and to work with this?
Well, for instance, it really depends what pathway is the problem. if the sulfation pathway, for instance, is affected, you might supplement something like Epsom salts to give you the sulfate that will enable the pathway to work better. If it's the glutathione pathway, you'll find ways of increasing glutathione to a point where the person can then detoxify. In something like Gilbert syndrome, where the glucuronidation pathway is affected, you can give certain supplements that will actually specifically support that pathway.
Okay.
One of the cases I've experienced a few times actually with patients is when they're detoxifying, and they know they're detoxifying, they actually have very unpleasant body odour all of a sudden. And with a little bit of working out what's going on, we now know that this is the glycination pathway.
Okay.
And we know how to support that with certain amino acids to prevent that happening.
Which I'm sure people will be very pleased to hear about.
Absolutely, because actually that can be rather an unpleasant, very antisocial symptom. So so there's lots of things that can go wrong, and we just need to look at the person's symptoms to work out what it is that we need to investigate further. Also things like just as basic as making sure the gut's moving, because the toxins come through the liver and then either go out through the urine or out through the bowel. And so if those pathways aren't moving, if the gut isn't actually moving,
it's going to build up.
It's going to build up. So obviously that's a major thing to look at as well, to make sure things are working. Okay,
great. And of course in this part 2, we'll talk about lymph congestion, which can be another reason what can be happening with detoxification.
Absolutely.
So thank you, Tanya, and we look forward to hopefully talking with you on that video very, very soon.